New videos every day.
Hi everyone, I'm Dr. Jeff Echols, and today we're very fortunate to have Miss Bethany with us here, who is about 6 months pregnant. So she's only got about 3 months to go, is that right?
Yep.
I bet you're ready for that.
Yes.
You know? And some of your more challenging months are still ahead, yes? Yeah. But she's doing quite well. But Miss Bethany's told me that she's been having some problems with dizziness. And she can't really stand for very long, and she's got several problems in her spine. But we're actually going to talk just about the dizziness today and how we might go about helping her with that. Now, the first thing I would do when I'm looking at a dizziness problem, of course, she could have an ear infection, but we would rule that out to make sure that she doesn't. Inner ear disturbances and even middle ear disturbances can sometimes affect the balance and with dizziness. So we check those, make sure that she doesn't have any problems with her ears, and she doesn't. So we're going to move on to the next thing, which is the cervical spine or the neck area. Now, the top vertebra, we have 7 vertebrae in the neck. The very top vertebra is called the atlas, and it's called the atlas because Atlas in Greek mythology is the guy who holds up the world. And this is where her world resides, right here, yes? So we're going to look at that, and when I look and I feel up there, Bethany, can you feel that little tender spot right there? Yeah. Now, she really wasn't aware of that before we touched it. And when she came to me, she wasn't complaining of really any neck pain at all, but just dizziness. But upon examination, I can feel that she's got one of the vertebrae that has been misaligned, and it's putting pressure on those nerves up there and causing some difficulties. It didn't really hurt when you came in to see me, but yet when I touch you there, it's kind of tender. And that's what a vertebra feels like when it's out of position. And it's right up there in the top part. So we're going to kind of move on down through the spine and feel the other vertebra here. Now the brain itself actually has a stem that extends down into the opening of the spine. That's how your brain communicates with the rest of the body. It sends the spinal cord down through the middle of the spine, and it talks to every cell in your body through those nerves. So it's important that there's no pressure built up on those nerves. You can imagine a computer trying to talk to a printer. If the cable to the printer was smashed, it wouldn't work, even though there may not be nothing wrong with the printer itself. It's the same is true with this. If there's pressure being built up along the spinal pathway, along the nerve pathway, it can interfere with just basic functions. Especially this can cause headaches. Now, luckily, she's not having any headaches currently. She was early on in her pregnancy, and that could have been to hormonal surges or whatever. But right now she is experiencing some dizziness, so we're making sure that she stays comfortable and gets to sit down whenever she needs to. But she's definitely having some misalignments in the cervical vertebra here, and I'm going to demonstrate how we would gently and safely go about taking care of that, and we'll see if that doesn't start to help her with her dizziness. Miss Bethany, when I adjust you up here, you're going to hear a little clicking sound, kind of like if you clicked your knuckles or something, but it'll be right in through here. And it'll probably feel pretty good because it's going to be a lot of release for you up here. So I want you to lay here on your back, put your head right down in the middle there. There we go. That's fine, just like that. Are you comfy there? Bethany, are you experiencing any dizziness while you're just laying here?
No.
No, you're pretty comfortable. Good. So we're going to get right back up on that spot on your neck that was kind of tender. Oop, is that it right there?
Yep.
Yep, I found it again, didn't I? All right, so that's that area right there, and that vertebra is actually rotated in your head. That's why I told you that your head wasn't quite on straight, okay? So we're gonna move this over a little bit. You'll hear just a little click. Move your head this way, good. Just a slight movement there is all it takes, and that vertebra really moved very nicely. Did you feel that?
Yeah.
Yeah, your eyes got about that big. That was wonderful. And she's laughing and having a good time with all of this, so that's a good sign. And we're going to go ahead and look on this other side to make sure there's no troubles. Right in there, we're going to gently move this way and relax, just like that. Now, Bethany, you're not going to try that at home, are you?
No.
And you're not going to try that on your husband, are you?
Maybe.
Maybe. Depends on how he behaves, doesn't he? So what we've done here is we've gone ahead and just taken that vertebra and gently moved it off. Now, do you feel a sense of maybe some pressure has been released from that area? Yeah, feels a little bit better, doesn't it? So Bethany, how did that adjustment feel for you?
Good.
Good. Did you get a sense that the pressure had kind of been relieved? Tell me what's been going on for you.
Yeah, I mean, it felt like something released that I didn't even know was there.
Right, yeah.
It's kind of weird.
Yeah, and it's really interesting. A lot of times when you go to a doctor of chiropractic, he'll be able to find misalignments in the spine and release that pressure that you may not even been aware of. Because oftentimes the problem is actually got to go on and on and on for quite a while before you're even aware of it. That's why preventative chiropractic care can be a real good idea. So I know you came to me for dizziness, and hopefully that will start to help with that, okay? But we found some problems in there that we're definitely going to take some pressure and release the pressure off of the neck, which is going to in turn help your nervous system to work better, which is definitely going to be good for the baby. Yes? All right. I hope this video has been helpful. I'm Dr. Jeff Echols. If we can help you, please visit my website, www.jeffechols.com.
If you liked this video, we have hundreds of more alternative videos ranging from sexual health to psychology to mind control. So if you liked it, go ahead and click on me to enter the Psychetruth channel.